Now this, CVS will become the first national retail chain to restrict how many pain pills doctors can give patients. The chain also requiring pharmacists to talk to patients about the risk of opioid addiction. I'm surprised this isn't happening already. But joining us now is Dr. Marc Siegel. This has been an issue very near and dear to your heart. Okay, so they're going to limit opioid prescriptions to 7 days' supplies. They're instructing pharmacists to contact doctors if they're concerned about the amount of medication being handed out. Also, caps on daily dosages. All of these things should be in place already, in my mind.
Well, yes.
I mean, why aren't they? We know the opioid...
They're not, because there hasn't been an open acknowledgement until now that pharmacies are playing a major role here. You know, doctors start this by writing over prescriptions.
Right.
Now, CVS is a really good place to start here because, Ashley, there's 90,000 patients that are involved in this. So
91 Americans.
I'm sorry, 90 million people.
91 Americans die every day from opioid addiction.
Right. Over 60,000 opioid overdoses a year.
Ugh.
This is a huge problem in the United States right now. It's the overdoses, it's the deaths. 1 out of 3 Americans are using opioids right now. 1 out of 3 Americans. Now, CVS caters to 90 million Americans, so they're the place to start. But this is assuming that we can't get physicians under control. I want you to understand that education to physicians, the right physicians prescribing for the right reasons, is where we also have to start. The reason that I really like this move by CVS is something called exposure. The more opioids you get, the more likely you are to be addicted. The longer you get them, the more likely to be addicted. The higher the dose, the more likely to be addicted. So CVS is limiting the dose. They're limiting how long people can take them for, up to a week. Now, it's going to be a hassle for physicians to be contacted by pharmacies, but then let us think more. Right. Are we really justifying this? You have a dental procedure, for example. You have a tooth pulled.
Right.
You may be in agony, and I don't want to downplay the pain. But usually, you probably need an opioid in that situation for 2 to 3 days.
Yeah.
Not 30 days.
That's crazy.
And plenty of people have their wisdom teeth
very
pulled.
Quickly,
don't use it.
On the same issue.
Back pain, the same thing.
I was reading an article, I think it was an op-ed from a doctor who said the biggest problem was when they started introducing pain management. Tell me, what is your pain on a scale of 1 to 10? A lot of people say, oh, it's a 12. And then the quality of care given was being measured by how people said that the doctor handled their pain. In other words, too much emphasis put on pain management. And that's what led to stronger and stronger opioids being prescribed and in greater amounts.
Exactly right, Ashley. Back when I was in training, they said we didn't consider pain.
Right.
Then they made pain the 5th vital sign that we had to ask everybody. And it's a subjective thing, how much pain you have. So here's the problem. With the Institute of Medicine saying that there are 100 million chronic pain sufferers, and us being told we suddenly have to ask everybody, here's the problem. We weren't trained in what to do if someone said they had pain.
Yeah.
So we panicked and prescribed opioids. Physicians did. Now, I'm not doing that. I don't want to give myself as an example because I don't overprescribe opioids. But many physicians, especially primary care physicians, didn't have the right tools, didn't have the right arrows in their quiver, didn't say, wait a minute, that back pain, maybe that could be treated with acupuncture, maybe that could be treated with physical therapy or muscle relaxants. You know, maybe stretching exercises, maybe heat, maybe chiropractic. There's many non-medical modalities that are useful. And another thing, send the patient to the right specialist.
Before you go, I want to get you another subject here. A new report revealing that Aaron Hernandez had stage 3 CTE, brain damage, related to playing to football. We know the tragic story of this individual. Who's to blame here? The NFL? Because apparently his level of CTE was off the charts.
Well, first of all, he had stage 3 CTE. CTE is an abnormal protein forming in the brain known as a tau protein that interferes with normal brain function. You start off with behavioral problems, with emotional problems, with anxiety, and then and depression. As you develop, you start having thinking problems. At the age of 27, he's literally the youngest individual to have this degree of chronic traumatic encephalopathy, the youngest. And it's a great tragedy, but the Boston University CTE Center, which found this and did this autopsy, I want you to know over the summer, they did autopsies on 111 NFL players and found 110 out of 111 had evidence of this disease.
Ugh.
Here's why, Ashley. It's because of chronic blows to the brain. It's not one concussion. It's not one hit to the head. In the military or in football, if you're getting chronic repeated blows to the head,
damage.
It does damage. It's tragic. This man, allegedly murdered people.
Yes.
And he committed suicide. And he was a great football talent, and this is a great, great tragedy to his family and to America. So
big issue for the NFL to address.
Right now.
Yeah. All right, Dr. Marc Siegel, great
Good to
stuff.
see you.
Thank you so much. Appreciate it. Let's check the Dow.